with us today is Dr. Chekakie from Cheyenne Regional Medical Center. Good morning, doctor.
Good morning.
Doctor, I understand that you do rather groundbreaking work, at least here in Cheyenne. Could you explain it for us?
Well, I am a specialist in what's called electrophysiology, which is a branch of cardiology that specializes in heart rhythm disorders, sort of the electrician, of the heart.
And I understand that as lately as Thursday that you really did a unique procedure. Could you explain that for us?
Yeah, we performed the first AFib ablation in Cheyenne Regional Medical Center. AFib is actually an irregular heartbeat that goes fast at times. It can cause patients to have fatigue, shortness of breath. Some people feel the fast heartbeats, and they're limited in their lifestyle. And these usually come from triggers from the pulmonary veins. And what we do, we get a deflectable catheter that's just a flappy wire through the veins to the heart, and we burn these triggers and isolate them.
So how does a patient know if they are a candidate for this procedure?
Well, any patient who's having these fast, irregular heartbeats and having symptoms, usually you try to help them with medications first, either to slow the heart rate or to put the rhythm back to normal rhythm. If these medications fail, you can always try this ablation procedure, and it has an 80 to 85% success rate.
Oh, wow. So are most of your patients for this procedure, are they generally older, or is it something that can affect all ranges of age?
It actually can affect all ranges of age. We see patients as young as 30 years old and as old as 80 years old. And it really depends on how functional the patient is, how active they are, and how much symptoms they have from it. Unfortunately, some of the patients come too late where they're really not feeling it. And some of them might have a weak heart because of it.
How long has this procedure been around?
Well, this procedure has been developed back in 1998, 2000, and it has gone several modifications. The last modification has happened back in 2004, and that's the current procedure, where you isolate the pulmonary veins and create separate lines.
Now, you are obviously a specialist in this, so how are people referred to this specific procedure?
Well, some of them are referred by their primary care physicians, patients with AFib. These are fast, irregular heartbeats. Sometimes patients with skip beats that can actually cause them to have fatigue. And usually these can be every other beat or every third beat. And if they're coming from a single focus of the heart, we can always target them and isolate them. And some people just hear about this procedure and contact us in Cheyenne Regional Medical Center. I am with Cheyenne Cardiology Associates there, and they can contact us there.
Is this what you would call a major surgery? What sort of downtime do you have after this?
Well, usually some of these ablations are simple ablations where if the patient comes in the morning, they can go in the afternoon. But for this procedure that we did Thursday, we usually try to observe the patient overnight, and the next day, if they're doing fine, they go home.
And you came to Cheyenne from Chicago. What exactly brought you here?
Well, several things. I got in love with the town. I got in love with the people. And this is a golden opportunity here in Cheyenne. I think I would like to help this community to establish this in Cheyenne. So this is for the people of Wyoming. One
windy city to another, huh?
Yes, exactly.
Doctor, thank you so much for your time this morning.
Thank you very much.
We appreciate it.